Welcome back to our course on inflammation. Today I'm going to talk about the external and internal signs that you actually have inflammation. Now remember, inflammation is your body's response to injury. It works to heal wounds and is your body's way of signaling the immune system to heal and repair damaged tissue. So let's talk about the first sign that you have inflammation, and that is that spare tire around your waist. You know you've got inflammation if you were to take a measuring tape and wrap it around at the belly button. If your waist size is greater than 35 inches for a female or 40 inches for a male, you definitely have too much inflammation, which is the visceral fat. And we now know that the visceral fat is the fat that wraps around your inner organs and releases something in your system called cytokines. And this causes diabetes, heart disease, cardiovascular problems, and blood lipid disorders. And the Metabolic Balance program is the only program that I work with that definitely reduces the inflammation and manages the visceral fat. Then we have something called high glucose levels. That basically means your sugars are too high. Remember, we live in a world where burger is the king and dairy is the queen, and we're consuming food that is crap, carbonated, refined, addictive, and processed. And if you want to lower your sugar levels continuously, then it's important to know that you have to eat food that's going to stay in your gut for a long time. So food that has a low glycemic index. And low glycemic index foods are foods that burn slow. Something like rye bread, an avocado, and an egg is going to stay in your stomach a long time, and your sugars are going to remain lower. If you eat something like an ice cream cone or a piece of white bread, your sugars are going to go up. So we're always trying to manage inflammation, and I will tell you about some tips on how we can manage that through your food. But you definitely do not want your cells to have too much sugar, because eventually it will cause your cells to be insensitive to insulin, and that is the cause of type 2 diabetes, which is completely reversible. Then you have digestive issues. That's gas, diarrhea, and constipation. Constipation is an area that we often don't even talk about because people don't talk about it. You are supposed to eliminate your feces out of your body within 24 hours. Not going to the washroom for 2 or 3 days is a sign that something is wrong. A lot of people will argue with you saying that it's normal. It's not. You do not want to have 3, 6, 9, 12 meals in your gut, because your gut cannot handle it and it's toxic overload. So it's important to increase your fiber so that you can get rid of that, but it's a sign that there's some inflammation going on. Gas is also a sign. There's two types of gas that smells and gas that's just a lot of sound. When the gas smells, you're not digesting your proteins and you're probably eating something that you're allergic to. And then of course the diarrhea, your body is trying to expel it. So I personally believe to never stop the diarrhea, just let it flow. I don't take anything to manage it. I might take some applesauce or some probiotics, but if the diarrhea is trying to come out, let the diarrhea go. Low energy. I have a personal belief that regardless of how old you are, you should all have energy 10 out of 10. So ask yourself right now, where is your energy at? And the energy is definitely related to what foods you're consuming. I am not going to get any energy from food that's manufactured in a lab, but I am going to get energy from food that grows towards the sunshine, like mangoes and papayas and strawberries and lettuce and broccoli. So remember, it's the 80-20 rule. It's what you do 80% of the time that's going to matter the most. So make sure your food is whole, live, and fresh, and that will give you definitely more energy. Excessive mucus production. You can have excessive mucus production either in your nose or in your feces. This is called the soldier salute. This is a sign that somebody's eating probably too many dairy products, and often kids will wake up in the morning and continually do that. So when there's excessive mucus or you have to blow your nose, you're eating something that your body's allergic to. When there's excessive mucus in your feces, there's also a sign there's a little bit of damage going on, and you possibly have what they call leaky gut syndrome, where food is leaking through. So you might want to watch that, because it'll definitely be another sign that you have that. Anything ending with the word itis, so that is bronchitis, bursitis, arthritis, colitis, these are all signs of inflammation. And remember when we talked in the very beginning, if the red light comes on the dashboard of your car, you do not put a Band-Aid over top of it. any of these itis things are, it's your body's way of saying there is something wrong. So you need to make sure what you're doing, or maybe you need to see a nutritionist, because we want to help this, because all of these things can be managed with food and some natural supplements. So don't think it's a normal thing, but it definitely is a sign that your body's inflamed. Fatty liver disease. Did you know that non-alcoholic fatty liver disease is on the rise? Diabetes is on the rise. Type 2. These are all signs of inflammation. There is 2 types of fatty liver disease. One is from alcoholics, or drinking too much alcohol, and the other one is non-alcoholic fatty liver disease, which means your body is storing fat. And often this is because we're consuming fast, frozen, fried, junk and processed foods. And you do not want to have that, because eventually it will definitely cause liver damage. And your liver is your major organ for detoxification. So we have to keep that working in its optimal way. And eating lots of fruits and vegetables is going to help that, and a lot of greens is going to help that. But again, you still need to manage your sugars, and that high fructose corn syrup is definitely leading to fatty liver disease. So check the ingredients on your items in your fridge, like your salad dressings and your cookies, because they contain a lot of that, and even soda pops have this high fructose corn syrup, which is making you deposit fat in your liver, which you don't want. Depression. There are more people today affected by depression, from young children to older children. I have never seen so many people depressed. Did you know that 95% of your serotonin, which is your feel-good hormone, is manufactured in your gut? And if your diet is poor, or you're not getting enough water, or there is other factors, you're not going to produce the serotonin, and serotonin makes you feel good. So it's not all in your head, it's in your gut. And if your gut is inflamed, you're not going to get your serotonin, and depression is definitely going to be increased. And then of course, allergies. Allergies are all signs that you've got some type of inflammation in your body. What I like to do with my clients is give them something called an IgG test. An IgG test tests for over 200 foods to see which foods you are sensitive to, because remember, we consume the same 11 foods almost every single day, and this can build up and cause allergies. But allergies is a sign that the immune system is down, and when the immune system is down, we have to look at everything. What are you eating? What are you drinking? Are you getting enough sleep? Are you taking any supplementation? Are you actually getting enough water? Because all of these things are going to create an environment for inflammation. So, thank you so much for joining me today. And after this video, stay tuned, because I have lots more for you. Thanks for joining me today.